I'm Dr. Katie Landier, the Senior Centered Physical Therapist, and welcome back. In today's video, I'll be showing you exercises to help you treat bunions. These exercises are ones that I learned from two chiropractors who created an online program and community called Gait Happens. I highly recommend you follow them on social media for even more great exercises. So for today, many people don't even realize that there are exercises that can actually help them treat bunions. While some people may need surgery, it's not a necessity. So if you have a bunion, make sure you see a PT first before having that surgery, because exercises may be all that you need. Bunions are a result of laxity in the joints in the foot. So particularly this joint right here and this joint right here. So what can happen is if we have that laxity, these bones can kind of shift and you can see how that big toe will kind of move inward, and then we have that bunion that forms right there. The same thing can happen on the pinky toe side. So we have that shift in the joints, and then we have that pinky toe that kind of hides underneath our other toes. So these exercises are gonna help create that space and recreate that alignment. So what you'll need for this workout are just a couple things. So you won't need a foot, you'll need your own foot. You'll just need a pen. And then for the bunionette or the pinky bunion, you'll also need a band. So that's all we're gonna need for this workout. Let's get started.
For our bunion exercise, we're gonna be working some muscles on the front of the foot. So for the lift, spread, reach, we're gonna be working that extensor digitorum longus that attaches at the shin, goes all the way to the second through fourth toe. And then we're also gonna be working this extensor hallucis longus, and that's gonna attach from the shin to the big toe. Then we're also gonna be working some muscles on the bottom of the foot. So for our pen taps, we're gonna be working this abductor hallucis, so that's gonna move the big toe towards our midline. And then for our bunionette exercise, we're gonna be working this abductor digiti minimi, which is gonna move the pinky toe away from the rest of the foot. That's all the muscles we're working in this video. Let's get started.
Okay, so let's start with our first exercise, which is that lift, spread, and reach. So we're gonna stand, making sure our weight is equally distributed between all four tires of the foot. So if our foot is a car, we've got a tire at the base of the big toe, tire at the base of the pinky toe, and then a tire on each side of the heel. So I'm gonna lift all my toes and I'm gonna keep the tires or the base of the toes down on the floor. And then I'm gonna spread my toes as wide as I can. Everyone loves doing this with their hands because their hands do it so much better. Sometimes it helps the brain, totally fine. And then I'm gonna reach my toes forward as I lower them down. So I'm gonna lift, spread, and reach. Lift, spread, and reach. And you can see on my left foot, that big toe doesn't like to move apart from that little one. So that's actually where my bunion is forming, right? So I really wanna try to get that left big toe nice and spread, and it's okay if it doesn't happen right away. It's gonna take lots of reps. Spread and reach. One more. Lift, spread, and reach. Shake those feet out. You will likely get foot cramps while you're doing these exercises, and sadly, I'm okay with that. So sometimes that cramp is just activation of those muscles in the bottom of the foot, and that's what we need. So you can always feel free to, rub the foot, shake it out, whatever you need to do, but foot cramps are not a sign that you should stop doing foot exercises. The next one we're gonna do is pen taps. So I'm gonna grab my pen here, just set it between my feet. And this is a huge challenge for me too. So the easier it is, or the closer the pen is to your toes, the easier it's gonna be. So if you need to adjust where your feet are relative to the pen, totally fine. But I'm just gonna show you on my right foot here. So I'm gonna lift my big toe, and then I'm gonna try to tap that pen with my big toe. You can see how my other toes wanna go with it. I'm gonna try to keep those down. And I'm just not rolling at the ankle. I'm not just lifting my foot, right? I'm making sure that that work is coming from the big toe. There it goes. Takes a couple reps for the brain to get it. I'm gonna turn to the side here too so you can see this abductor hallucis really working. So I'm lifting that big toe, and then I'm reaching, and just right in that arch, you can really see how that muscle is really working. You can also see how all of my toes want to help. Super normal. So just trying to keep the base of that big toe down, reaching over and reaching back. My pen shifted, so that's okay, it happens, but just really make sure you're feeling it in that arch. Next, we're gonna grab our band and take a seat. So I've got my band and I'm just placing it on the floor, and then I'm just gonna step on it. So my heel is keeping that band nice and contacted with the floor. And then I'm gonna wrap my band so it catches my pinky toe. And then I can pull my pinky toe up. You can already see how my other toes wanna help, and that's so natural, but we're gonna try to keep those toes down, and then I'm just gonna press that pinky toe down against the band. Try to get it down to the floor. You can see too how it creates that space at the bottom, which is great because that's gonna help get that pinky toe out from underneath my other toes. So just lifting and lowering, and try to control the lift if you can, and then press that pinky toe down. Ooh, a lot of work in this tiny little movement. I'll do last two. Last one. You can always, even if you don't have a bunion or a bunionette on one side versus the other, you can always do this on both sides to help prevent that from happening. Because of course, if you're wearing those pointy shoes that kind of have that narrow toe box, and you already have a bunion on one side, you're wearing the same shoe on both feet, hopefully, right? If you didn't get dressed in the dark. So make sure that you're working both sides and both feet to help prevent bunions on the other side as well. So our last exercise, I'm just gonna ditch my band, and I'm gonna take my foot and cross it over my other leg. Then I'm just gonna take my fingers and interlace them between my toes and just give a nice roll through the ankle. I can also twist the foot a little bit, but this is helping create space in those toes, kind of loosening up some of those maybe tighter muscles in the foot, and then I can reverse directions. And also you can always invest in toe spacers. So that's a great thing to do if you have a bunion, to get this space, this alignment back in the foot. Get some toe spacers, wear them, starting for 5 minutes or 10 minutes during the day, and then see if you can up that every week or so to try to get more of that alignment and space. So I'm gonna unlace my fingers, and then once again, you can always do that on both sides. But that's it. That's all the exercises I have for you today to help decrease bunion pain and the formation of bunions. Until next time, I'm Dr. Katie Landier, the Senior-Centered Physical Therapist. Have the strength to live life to the fullest. Bye-bye.